morning, ladies and gentlemen. I would like to thank all of you for attendance today and Emirates Society for the special invitation as pain management. It's a great honor and a pleasure to participate this year again after the successful event last year in this prestigious event. Just correction, I am anesthesia consultant and pain management. Working in Harley Street, we are running pain clinic. Today we will discuss acute medicine in Ramadan. I will focus on two hot topics, osteoarthritis and migraine, just to save time. Okay. This is my background. I am faculty in Gulf Pain School, faculty in the New York School of Regional Anesthesia and European Society, SIPS certified, and I am so happy with this certificate. I am the first Syrian doctor in the world certified with this one. Ramadan Kareem for all. No conflict of interest to disclose. Today we'll discuss fasting safety during Ramadan. What is the evidence? Can fasting improve chronic pain in some disease, which is a very interesting topic, and how to optimize pain management for specific disease. Fasting during Ramadan, all of us know, lead to variation in routine activities of daily life, like sleeping pattern, circadian rhythm, and the change of hormone levels. So this will lead to change in cognitive function, mood, and weight gain, and sometimes weight loss. According to a study in rheumatology, checking the safety of fasting during Ramadan, which is a new study, 2020. So patient can safely fast without any additional risk. Always I check when our patient come visit us before Ramadan planning for fasting, always I check for the evidence, because so many patient educated, so many search Google, and some of them our colleague, of course. This is beautiful study, intermittent fasting, which potential utility in the treatment of chronic pain across the clinical spectrum. Also recent study 2022. Regarding fasting in pregnancy, may be feasible and safe, decrease the risk of gestational diabetes mellitus, and improve the level of hormones and metabolic marker and fat distribution. There is systemic review regarding diabetes in Ramadan, which is also safe, sometimes can increase the risk of hypoglycemia, as we know, or DKA, and some study confirm it's safe without any effect. Usually the level to, I advise the patient the level to break the fasting when blood sugar reach 60 to 70. Any comment for this level? All agree? 50? Okay. This is a beautiful study done in Abu Dhabi, which is checking the visit for emergency department. There is also large study done in Saudi Arabia over 3 years, checking, visiting the patient to emergency department, and the most complaint was abdominal pain. Headache was very less, just to take into consideration that this study done in Saudi Arabia during COVID. So this is beautiful news for our colleagues in emergency department. In Abu Dhabi, the visit is less. So we'll go to next topic. Can fasting improve some states of chronic pain? As we know, we have 6 types of pain: mechanical, inflammatory, neuropathic pain, ischemic pain, visceral pain, and central pain. So regarding inflammatory pain, there is evidence for a potential therapeutic role for intermittent fasting in some specific disease like rheumatoid arthritis, psoriatic, ankylosing spondylitis, fibromyalgia, and MS. Regarding osteoarthritis, as we know, intermittent fasting can reduce fasting insulin, which is one contributing factor for cartilage damage. Also promote weight loss, which improve mood and make patient able to participate in more physical activity and more physical treatment, physiotherapy. The other thing, intermittent fasting, a study also confirmed that it's reducing the adipose tissue, which is the source of releasing inflammatory mediators. always when I discuss with my patient the plan for pain management, I send him to the specialist responsible for his diagnosis, number one, discuss with his doctor what the possibility to optimize pain management. So for nutrition, always I search for adjuvant can improve with evidence the chronic pain disease. So there is evidence for curcumin and not turmeric because there is difference between the concentration in the product. The mechanism of curcumin to block the pain receptors, its effect like exactly COX-2. There is 2021 review of 15 randomized controlled trials confirmed the effect, which is different doses between 40 to 1.5 gram. There is meta-analysis also confirmed the safe dose up to 6 gram per day, and is comparable to ibuprofen 1,200 gram per day. So 3 doses of curcumin per day equal to 1,200 milligram ibuprofen, which is also beautiful, especially for the patient with kidney disease or liver disease or heart disease. Regarding curcumin, usually the experts prefer the high quality product which is studied in clinical trials because the market contains a lot of products. So the best brands using black pepper as advised by them, phospholipid, antioxidant or nanoparticles. To increase the absorption of curcumin as supplement to improve pain management should be taken with some fat. This is also beautiful. The study recommends the dose 500 milligram twice daily for both osteoarthritis and rheumatoid arthritis. There is something very important here, should be tested by third party because some product contaminated with lead. In Ramadan, I feel the best way to treat pain, especially for osteoarthritis or other chronic pain disease, plaster and patches, which is not taken through the mouth. So regarding Sheikh, he advise and support us as Muslim during Ramadan to not affect our fasting. The absorption usually is safe. We can increase the number of plaster and patches. For example, like for lidocaine, we can put 3 plasters together on one time, and it will be 12 hours on, 12 hours off. So if we put it during suhoor, it will stay 12 hours. It will support our patient. Always I mix the plaster and patches with oral, depending on the pain condition. For example, neuropathic pain, capsaicin, it will be great option, which is proof by evidence. The other one, I keep it to the last, buprenorphine, and other option menthol, which sometimes burning, make patient not tolerate. The other option like diclofenac, we have different brands, also can be used twice daily, which is a great option. Now, we'll discuss migraine during Ramadan. As we know, the treatment of migraine is tricky. In Ramadan, it will be more tricky for many different factors. During fasting, as we know, during Ramadan, the first day of fasting during Ramadan will be the worst for migraine patient. We expect the severity and the frequency, it will be increased during Ramadan, especially the first day. And as all of us we know, the migraine triggers are change in sleeping pattern, eating, caffeine withdrawal, and dehydration. So I have one lady smoking a lot, 2 packets per day, and drinking coffee at least 10 large mugs per day. Since last month, she started, as we advise and discuss, to move the coffee and reduce the amount. For example, every 2 hours, starting from 2 months before. So moving and pushing the time, when we reach Ramadan, it will be after iftar. This one idea how to manipulate with our patient. We advise them to do gradual shift in body clock, wean coffee as we discuss now, this example, starting from 2-3 months before. We can advise them to practice fasting 8 and 16, 8 hours eating, 16 fasting, and reduce gradually as tolerated. This is also a beautiful maneuver. As all of us we know, preventive is better than cure. This very famous Arabic. Also, the food and the sleeping. As all of us we know, migraine can be triggered by fluctuation in blood sugar, either rising up or going down. We advise them to take special food regarding carbs and sugary foods, which is the one responsible for this fluctuating. There is long list. We can arrange 2 months before to follow and be strict with this advice. Here, we discuss pain management always with our patient as part of multidisciplinary team. I contact all doctors responsible and send them to other specialty as needed. We can take the food, which is release energy slowly during suhoor. It's very important also to maintain the same level of patient comfort. We advise them to sleep 8 hours at least per day. So going after iftar to parties and is not always recommended for migraine patient. Okay, 8 hours of sleeping very important, and naps not usually recommended. So, regarding the preventive medication, we advise them to take medication during suhoor and iftar. We arrange with the neurology doctors, and they do this in a very amazing way. They start to move from short-acting to long-acting medication, which can be taken as general advice for any medical problem for patient during Ramadan, once or twice daily, long-acting or sustained-release medication. So, there is a very beautiful study related to celecoxib. They tried that if patient take celecoxib for the first 15 days in Ramadan, so it can protect and reduce the frequency and severity of migraine attack within the first 5 days, which is a very beautiful study. The supplement, to optimize pain management, we cover all 36, let's say 360-degree the pain. One of them, supplement. So we advise patient to start supplement within 2 to 3 months. As all of you know, magnesium play a good role in protection from migraine, riboflavin, and coenzyme Q10. A lot of study with different doses depending on patient response. The other supplement free Butterbur and feverfew, also there is evidence, can protect, and vitamin B6, B12. The impact of curcumin of migraine, there is comprehensive review, also a recent study, 2023. It's a promising candidate for preventing and controlling migraine, anti-inflammatory, antioxidant, and antiproton aggregate, and analgesic effect. This is some products available in the market with different concentrations. Some of them FDA registered, some of them recommended by National Headache Association. This is the effect of curcumin according to the systemic review, how it's work. It's act on interleukin 6, TNF alpha, and other inflammatory markers. So, what about non-medication treatment to optimize migraine? We can advise patient to do osteopathy, chiropractic, massage, acupuncture, and which is very helpful in reducing the severity of migraine. Also hot and cold packs around the head and neck, very important to cover head and neck together, which is provide some relief for some patients. Also, the headache balm can temporarily relieve the pain. This is what's available, different shape, different model. This one, the black one, is fashion for the lady love fashion. And one interesting one, the light, the green one. I have no experience with this one, but I will advise my patient to use it to see the response. To be honest, the light is new for me, but I like the idea. This is other one, patent acupressure device, which is working on the L14 point. They put it here. There is other one, the one on the left bottom. There is piece to be put in the ear, and the patient to press, so it will stimulate the vagus nerve and trigeminal. It will
Sorry,
block.
doctor, you have 5 minutes.
Yes, almost done. And it will block the pain signal transfer to the brain. So this is how we do treatment for migraine in pain clinic. Usually after failed conservative management, the neurologist or internal medicine send the patient to our clinic. We can do greater occipital nerve block and supraorbital nerve block by ultrasound. So we put ultrasound. I put this case because it's very challenging. Usually this is abnormal anatomy. This is the lady, she was drinking coffee and smoke 2 packets per day, and she is not able to stop or reduce the smoking. As we see, inflammatory process is very high, the pulsation is very, very strong. Usually this is not the typical view. Usually we see the greater occipital nerve and the artery beside, small artery. We use color Doppler. It's recorded video, but I couldn't erase the name, so as kind of respect to patient privacy, I didn't upload the video. So usually the one on the bottom right, this is the supraorbital nerve block. Also, the nerve here is not visible, only the artery. So the white line is coming, maybe difficult because this, to make patient comfort, I am not using the echogenic needle. I use 25 gauge, the orange one, to make patient more comfortable. So maybe the needle here is difficult to see. What about daily activities? We have to advise patient to adjust daily activities, not to look down for a long time. This is increase the stress on the neck and the head, which increase the severity of the migraine attack. We advise them to use light blue protection, and during activity in the sport, during sport activities in the fresh air, okay, without over exercise. There is beautiful thing, it was described 2021 by Saudi study. There is a new type of headache. I wanted to highlight this because also it was a new for me, but a beautiful study. There is a new type of headache prescribed. Doctor, he is happy. Yeah. This is usually not meeting the criteria for postprandial headache and not meeting the criteria for other definition of headache according to American Headache Society, the international classification. So this headache is seen after iftar, breaking the fast, within the first 4 hours, usually increase after fried food and coffee. So please, when we met this one, we have to focus on this new type of headache, okay? And manage, of course, advise our patient to avoid fatty food or fried food and reduce the amount of coffee if they cannot avoid at all. It's coming as episodic in nature, usually tension type or heaviness. This is the same. To conclude, the game during Ramadan to use twice a day or once daily tablet. We have a lot of brands in the market. Patch, I love patch a lot during Ramadan because we combined both to take the effect, especially with mixed pain like neuropathic and inflammatory. So we can use lidocaine, we can use capsaicin, non-steroidal, which is very, very important, this combination to block all pain receptors in the brain. Thank you so much, and Ramadan Kareem for all.